To better understand the health impacts of COVID-19, researchers at the University of Arizona are said to be leading the first statewide long-term public health study of COVID-19. 9 on your side's Taja Davis spoke with the researcher leading this study.
Arizona Cohort, an epidemiology study looking at large groups of people throughout Arizona and studying them over a 5-year period.
We have 99% of people survive this. But what happens to those 99% of people? Do they have longer outcomes, which we've seen in other infectious diseases? So we know that infectious diseases can cause chronic outcomes.
The idea is to follow people who have become positive and see what outcomes they have. But Dr. Pagriba Brown says it's also important for researchers to study those who haven't become positive during the pandemic as a baseline. Here, she is giving the example of using a baseline with diabetes.
If you followed a group of people over time, even before COVID, you would have some number of those people develop diabetes, right? So by having the people who haven't been sick, we can understand what that baseline is. Also, when we have people, so they enroll in baseline, maybe they aren't sick, but they get sick at 3 months into our study, then they let us know.
The cohort study will be looking at side effects many people have already claimed to have after contracting and recovering from coronavirus, such as hair loss, continued fatigue, tooth decay, and an elevated heart rate.
It's not like influenza where it's mostly just a lung disease, right? We have everything literally from head to toe. So you have people who are report kind of very brain fogginess and have trouble concentrating, all the way down to people who have what's called COVID toes, where they have these, their toes turn purple, and it's because of a lack of circulation.
So she says this particular study will take a step back and rigorously look at the timeline and circumstances under which lingering symptoms develop, and also looking more closely at those who have contracted COVID but have not been hospitalized.
Looking at the non-hospitalized population is really important too, because those people are likely to survive, but what might the outcomes be that they have in addition to that? So those are the reasons that our study is a little bit different, is by opening it up so much, we're able to look at both the hospitalized population, but really the non-hospitalized populations, which has not been studied nearly as much in the literature thus far.
Any Arizona resident can participate whether you have had COVID or not. To learn more and to sign up, visit our website. Taja Davis, KGUN 9 on your side.